So we're going to start in a moment with our next speaker. So Sofie Boterberg from Ghent is going to speak about motor challenges in autistic children, prevalence and association with autism characteristics.
So, good afternoon, everyone. My name is Sofie Boterberg, and I'm a clinical psychologist currently working as a postdoctoral researcher at Ghent University in Belgium. And I'm happy today to present some results based on a broader project which aims to investigate the development of school-aged children with autism. And I would like to discuss more specifically motor challenges in autistic children, their prevalence and association with autism characteristics. It's also important to mention before I start the presentation that the results will be discussed from a researcher's perspective. So motor skill delays and challenges with motor movement are currently not part of the autism diagnostic criteria, but we see that there is a growing literature showing that they are highly prevalent in autism, ranging from 50 to 88%. And autistic children show particular delays and challenges in fine motor skills, ball skills, and coordination. And today, the ICD-11 and DSM-5 guidelines permit clinicians to diagnose individuals with autism with a co-occurring DCD or a developmental coordination disorder, which is a neurodevelopmental condition of challenging motor proficiency that affects activities of daily living. And a co-occurring formal DCD diagnosis is present in 14 to 50% of the children with autism. So given the influence of intellectual disability or cognitive function on motor in coordination, it is important to take into account the influence of intellectual disability on the DCD likelihood, especially since intellectual disability is present in 33% of the children with autism. And today, it is not yet clear how motor challenges are associated with core characteristics and intellectual disability in autism. And more insight into this association could inform the debate on whether motor challenges should be added to the core autism diagnostic criteria or at a minimum as a new domain-specific specifier. And a specifier means that motor challenges may be specified within a diagnosis of autism, which could provide a more detailed overview of an individual's functional abilities. And although many autistic children have motor challenges, only a minority, only 1 in 3 receives physical support, and this is based on USA data. So what are the research questions in this study? First, what is the prevalence of motor challenges and co-occurring DCD in autistic children? Second, how is DCD likelihood associated with autism characteristics and intellectual disability? And third, what is the prevalence of physical support services? So the participants in this study included 100 children between 3 and 11 years old, and they all had an official community diagnosis of autism spectrum disorder confirmed by a multidisciplinary team. 71% of the children were boys, and we sought to recruit a community-based sample from Flanders through social media, home guidance organizations, and multidisciplinary rehabilitation centers. And all the children and their parents participated in a voluntary way. It is also important to mention that the sample sizes differ across analysis due to variations in inclusion criteria and available data. So motor ability and the likelihood for DCD were measured through the Movement Assessment Battery for Children, or the Movement Assessment Battery, the second edition. And we distinguished 2 groups, a group of children with a lower likelihood for DCD. So these are children who have scores above or at percentile 16 on the movement ABC. And we also have a group of children who have an elevated likelihood for DCD. So these are the children with percentile scores below 16. And this elevated likelihood group consists of children who are classified by the movement ABC as DCD likely, so these children have percentile scores below or at 5, or children who need to be monitored for DCD. So these children have percentile scores between 6 and 15. We also collected information on the presence of a co-occurring formal DCD diagnosis through the clinical diagnostic report, and autism characteristics were measured through both parent reports and teacher reports. So we used the SRS-2 for this, the screener questionnaire, and we also use clinical observation to measure autism characteristics through the ADOS-2. Intellectual disability was measured through the Wechsler Nonverbal Scale of Ability, and physical therapy service information was collected through a parent questionnaire that was self-developed by our team. So the first research question, what is the prevalence of motor challenges? So we did a frequency analysis of the subscale standard scores of the movement ABC. And first we looked at the subscale manual dexterity, which measures actually fine motor skills. So examples of these tests for the age band 7 to 10 years. So we also have younger age bands, for example, for children from 3 to 6 years old, which are different at these subtests, but measuring the same construct. So examples are placing pegs in a board, threading a lace, and drawing a trail. And it was found that 65% of the autistic children had scores below percentile 16 on this subscale. Then we have the second subscale, aiming and catching, where children have to throw a ball and catch it with their 2 hands. And then we also have a test where children have to throw a beanbag onto a mat. And we found that almost half, or 47% of the children had scores below percentile 16. And then on the last subscale, so on this subscale, children have to balance on one leg on a board. They have to walk heel to tiptoe on a line, and they also have to hop on different mats. And for this subscale, we found that 36% of the children had scores below percentile 16. And these were all significantly different from each other, these subscales. So this means that most motor challenges were found with regard to the manual dexterity subscale or the fine motor skills. Then we investigated DCD likelihood. First, we looked at the movement ABC total standard scores. We found that 42% of the children were categorized as DCD likely, and 21% were classified as need to be monitored for DCD. So in total, 63% were at elevated likelihood for DCD. Based on the formal clinical diagnosis, the formal clinical reports, we found that 50% received a co-occurring DCD diagnosis. With regard to the second research question, we found that there was a significantly higher presence of autism characteristics as reported by the parents, as you can see on the graph, the SRS2 graph, but not by teachers or clinical observation, so also not on the ADOS2, in children with an elevated likelihood for DCD. With regard to the association with intellectual disability, we found a significantly higher presence of intellectual disability in the group who have an elevated likelihood for DCD as compared to the lower likelihood group. And then we also had a look within the elevated likelihood group for DCD, and we found that the presence of the autism characteristics did not differ between children who had an intellectual disability and children who didn't have an intellectual disability. And with regard to the last research question, we found that children received physical support with a mean of 83 minutes per week. 93% of the children with a co-occurring DCD diagnosis received physical support, and we found that more children within the elevated likelihood group for DCD received physical support compared to children with the lower likelihood group, with the lower likelihood for DCD. So what can we conclude? We found that nearly 2/3 of the autistic children were at elevated likelihood for DCD, and this is in line with previous studies also using a standardized motor test, and 15% received a DCD diagnosis. And also consistent with earlier findings is that most motor challenges were present in fine motor skills. We found that there was an elevated likelihood for DCD, that this was associated with intellectual disability, and more autism characteristics were found in children at elevated likelihood for DCD, independent of intellectual disability. And physical support services were used more by autistic children with DCD or at elevated likelihood for DCD than by children at lower likelihood for DCD. So what are the implications? It's a lot of text here, but I'm going to read this through with you together. So screening for a co-occurring DCD diagnosis and evaluation of motor challenges should be included in the diagnostic procedure and support strategies in autism. And we think that recognizing motor challenges and the presence of a co-occurring DCD diagnosis in autistic children with or without intellectual disability is crucial. And standardized assessments, such as the movement ABC, they can identify motor challenges, but at the moment there is no golden standard to assess these motor abilities or to diagnose DCD in autism. And in Flanders, in Belgium, it seems that the majority of autistic children with co-occurring DCD or at elevated likelihood for DCD receive physical support, but there is still a considerable number of children with motor challenges who do not receive physical support. So it is also the case that DCD as a co-occurring diagnosis may pose several limitations, such as not being able to recognize motor challenges at an early age, given that it is not recommended to diagnose DCD before the age of 5. And there could also be potential complications in communicating challenges when there are multiple diagnostic labels, so both autism and DCD. And if motor challenges would be added as a domain-specific specifier for autism, this could bring greater recognition and inform the clinical guidelines. But further research is definitely needed to clarify the characteristics of motor challenges in autism in terms of their causes, their presentation, and their functional impact. And I want to thank all the parents and the children who participated in the present study, our recruitment partners, and also my research village, my colleagues in the Research and Developmental Diversity team in Ghent.
Wonderful. Thank you so much, Sophie. That was brilliant. Have we got any questions? Please come forward.
Thank you, Sophie. I wonder if you could speak to the point you made about the elevated risk for DCD being associated with a diagnosis of intellectual disability, and if you could speak to the implication that since even a nonverbal test of intellectual ability requires a motor response, if that association might not actually call into question the validity of the ID diagnosis.
Yeah, I'm not sure what you totally, do you mean if the movement ABC is capable of measuring these motor skills in children who have intellectual disability?
I mean that since children who are regarded as and diagnosed as having an intellectual disability, in part, receive that diagnosis through an assessment instrument that requires a motor response to the questions, knowing that those children have difficulty with motor responses, might not that call into question the ID label in the first place?
Yes.
I'm sorry if that's unclear.
So if I understand correctly, you mean that by the motor challenges that they have, that it's difficult for them to accomplish like the intellectual test?
Yes, and if perhaps the low score on the Wechsler nonverbal test is as much related to their motor difficulty as to any purported intellectual difficulty.
I think that's a very fair question, and that's something that should be looked in more. So we use the Wechsler nonverbal test already because this test is more applicable for children with autism when you compare it to the more regular intelligence tests. But indeed, it's all entangled, I think, like the motor challenges that they have, and in more intellectually, like the cognitive functioning. So, but I think, there needs to be more research on how these two are entangled and how you can measure them. And they are certainly, during the tests, for some tests it's really needed that you have sufficient motor abilities.
Right, whether that's simply an additional implication of your findings. Thank you.
Thank you, thank you.
Have time for a very quick question.
So I'm a dyspraxic clinical psychologist, the evidence of the chair being knocked over as I tried to come here. I'm just a little bit concerned. I'm a bit concerned that if it got subsumed within autism, are we in danger, given that I prefer the term dyspraxia, it explains me better than a developmental motor coordination difficulty. I'm a bit concerned, given in the UK, dyspraxia is the least recognised, probably the most prevalent of all childhood diagnoses. I'm a bit concerned that it might get subsumed within the motor coordination difficulties that we do routinely see in autistic individuals, and that dyspraxia might sort of disappear. Do you have any? And in our country, we don't, you mentioned to 5 years old. Most of our occupational therapists would say around about 7 in terms of bone formation and things, so they're more reluctant until the age of 7. Just wanted your opinion on that.
Yeah, I think that's also an important question, and I think it's definitely important to recognize that there could be DCD or dyspraxia, so it still needs to be investigated during the diagnostic process. You really have to focus on that, but yeah, so it's really not something that can only be seen as part of the diagnostic criteria for autism for now, and not all children have them. So I think, yeah, but there needs to be more awareness, definitely, for DCD, and it can be diagnosed even sometimes, if it's very clear, younger than 5 years. But that's why adding, for instance, these motor challenges to the diagnosis as a specifier, which is not present in all the children with autism, this could bring more recognition for motor challenges at a very young age. And then as from 5 or 7, you can also look at the presence of DCD or dyspraxia, but they can already start with some support earlier on. So I think that's the important message.
Thank you very much.
Thank you.
Thank you, Sofie.